The following portion of Daytime is sponsored by AdventHealth.
Life gets busy, and sometimes making an appointment for yourself takes a backseat to just about everything else. But our next guest says that we should always make our health a top priority. Here to tell us more about the importance of regular screenings is Dr. Elizabeth John with AdventHealth. Doctor, welcome.
Thank you.
Thank you. I know this is really important because so many of us put this off. What would you say are some screenings that we should not put off?
Oh, wow. Okay, there's not a whole lot, but there are very important ones. For a woman, it's the well woman exam, getting a heart health checkup, which consists of blood pressure checks and your cholesterol, and then getting mammograms, and then the colonoscopy, and the fifth one would be the pap smear, getting a cervical cancer screening. And then for men, it would be the wellness exam, heart also, getting that checked, colonoscopy, and the fourth one would be getting a prostate exam.
I know that we have all heard those lists before, and yet for some reason we often still say, What would you say are the long-term effects of putting off something that your doctor has recommended?
Oh, wow. Something that could have been prevented, or something that is just so minute that could have been progressing into something much bigger. So that's definitely key, you know, nipping it in the bud. And so you can detect so many things before it can happen. And just, you know, like this month is breast cancer awareness. So if you notice a lump in your breast, don't put it off. Just talk to your doctor about it, get a mammogram, a possible ultrasound, something simple as that.
And doctor, you practice what you preach. I know that you just had your first colonoscopy. A lot of people are scared to do that. Tell us about your experience.
Actually, it was a good experience. You know, when I got to the hospital, after I changed and they put me on the bed, you know, they put an IV in and started the medicine. I was asleep through the whole thing. So I didn't feel a thing. I wasn't in any pain. And then I woke up in recovery, and, you know, it was great, you know.
Yeah.
And
I know the prep is not so fun, but people say it's like the deepest, best sleep of their lives, and then they're so glad they did it, right?
Exactly, yes. And that's exactly what I would say. The not the worst process of it, but a time-consuming process is the whole preparation, the whole bowel prep, being on a clear liquid diet. That's just, you know,
right.
But the actual scope itself, it's actually fine.
Exactly. And
piece of cake.
And when you measure the benefit versus the risk of putting it off, I think it's a no-brainer. And isn't that your message today? This is about self-care. This is about your health and your future.
That's exactly right. You know, with my colonoscopy, they did find a precancerous polyp. And right then and there, they were able to remove the polyp. And I'm good for a few more years.
Wow.
So, yeah.
That's the best example, more than your words, your experience. Doctor, thank you so much.
Thank you.
Good to have you here. And if you would like more information, please visit yourcareexperts.com. Let's not put these things off. Daytime will be right back.
The preceding portion of Daytime was sponsored by AdventHealth.